Hi, we're the UTHealth School of Nursing, and this is our presentation on elder self-neglect, an underreported problem in Houston's Third Ward. For this project, we assessed the community environment of elders, and we found that the Greater Third Ward of Houston has a rich, unique heritage and is the site of Emancipation Park, a major landmark of African American history. As of the 2000 census, 11% of residents in the Third Ward were 65 and older, with the majority of residents being Black native Texans. 67% of the employable population were either unemployed or not in the labor force, and almost half of the population lived below the poverty level. 10% of the population living below the poverty level were elders. 45% of those residents reported they did not have a high school diploma, and 27% reported high school as their highest level of education. From 1999 to 2002, the most common causes of hospitalization were due to cardiovascular and cerebrovascular disease, childbirth, mental health disorders, and respiratory disease. The leading causes of death were heart disease, cancer, and stroke. The demographic data from the Greater Third Ward of Houston closely resembles that of Texas. Key differences are that the population of Texas is predominantly white and Hispanic. The unemployment rate is only 4.2% in Texas, and there are more high school graduates and people with some college education than in the Third Ward. Window survey observations were made, including community strengths such as access to transportation via metro buses, and weaknesses such as houses in disrepair, not enough fresh food grocers in the area, and even unwalking paths. Although there was noticeable poverty in some areas of the Third Ward, self-neglect was not readily apparent. This is because self-neglect is an insidious condition that can be extremely difficult to diagnose from the outside. The problem is most notable from the inside of homes, such as in this example picture. Dr. Sabria Pickens, a nurse educator with expertise in self-neglect, states, "There is little literature about self-neglect, and not a lot of people are aware of the gravity of this problem. Since the outward signs of self-neglect can be hard to identify, we turn to the experts in the field, Dr. Jason Burnett and Siona Revev, for the insight into this huge problem." We will play the clips in the next slide. Here are some more pictures from our windshield survey. The community problem we selected as being of crucial importance is deficient public knowledge about self-neglect. Our intervention for this problem is to educate a large audience about self-neglect via an online video. Our rationale is that increased knowledge related to self-neglect can help with greater identification of the problem and knowing the steps to take when self-neglect is suspected. Research literature about self-neglect is severely lacking. What we did find that in Article 1 is that self-neglect is a serious underdetected problem facing the community due to lack of research about valid measurement tools. In Article 2, a knowledge disparity is shown to exist even among people who deal with social issues as part of their work. This study found that community nurses had less knowledge about self-neglect than social workers. Signs of self-neglect are usually not outwardly apparent and not widely known. In Article 3, it shows subtle contributors to elder self-neglect include deficient problem-solving capacity, insufficient social support, and inability to physically care for oneself. Self-neglect is a significant health-related problem affecting the elderly population in Houston's Third Ward that many people do not know about. Our community diagnosis is deficient knowledge about self-neglect of elders in the Houston Third Ward among the general public related to insufficient public exposure to information about self-neglect, as evidenced by statistics and expert testimony that public knowledge is severely lacking in this community. Our outcome goal is to educate the general public about self-elder neglect through this online video presentation. We will evaluate our intervention by seeing if we reach 500 views of this video in 3 years' time. Our educational interventions are supported by literature. According to Article 1, self-neglect cases are often complicated by the right of self-determination and competency issues. Healthcare professionals and the public are in need of more education on this topic. And in Article 2, it states refusal and underutilization of elder abuse services is a major problem, but there's increased service utilization when referred by the family or as a self-referral. Article 3 suggests that one barrier to self-reporting among older adults is a fear of being placed in a care facility. Educating older adults about services that Adult Protective Services provides can help overcome this barrier. Our target community interventions is to increase the awareness of self-neglect at the family and population level in order to assist in the detection and reporting of cases. Our measurable objectives for this intervention are to expose online video viewers for information about the prevalence, signs, and ways to intervene in self-neglect, as measured by the number of times our video is viewed in 3 years. We will consider our goal met if we reach 500 views in this time frame. Since our objectives are education-based, the resources needed include pertinent information on the teaching point and a willing viewer with computer access to this video. We'll now provide in-depth explanations about the prevalence of self-neglect, how to recognize it, and what to do if self-neglect is suspected. Self-neglect is a very common problem and is the #1 reported allegation to the Adult Protective Services across the country. In Harris County alone, 35% of older adult cases are of self-neglect. Risk factors for self-neglect include depression, dementia, substance abuse, and impaired executive functioning, chronic medical conditions, and functional disability or frailty. A common misconception about self-neglect is that people who self-neglect are just depressed or don't care anymore. Contrary to this assumption, people who self-neglect often have decreased decision-making capacity due to a decline in executive functioning in the brain's frontal lobe. It's important to know how many conditions that cause this problem can be treated. Signs of self-neglect can be subtle. However, personal appearances may include disheveled appearance with poor personal hygiene, undertreated medical conditions, and bed sores. More apparent signs that can be seen in the home include living without food, water, or utilities, pet waste in the home, or unsafe, deplorable living conditions. If you suspect self-neglect, make a telephone or online report to the Texas Department of Family and Protective Services, and they will make a case with the Adult Protective Services. Proof of abuse is not needed to make a report. In case of an emergency, always call 911. APS is a state-run government organization whose mission is to protect elders and those with disability from abuse, neglect, and exploitation. They investigate cases, arrange for services, and prevent further harm. Attorneys, clergy members, healthcare professionals, social workers, and mental health professionals are all required by law to report any suspected elder abuse. Failure to do so is a Class A misdemeanor. When APS gets a report of self-neglect, a caseworker will investigate or may call in a medical professional to perform a capacity evaluation. Caseworkers refer clients to medical, financial, psychological, and transportation services. They can also arrange for house cleaning, provide groceries, medications, and help eligible clients with rent and utility expenses. Take a moment to read the following case about Mr. X and determine what red flags would indicate self-neglect. Signs of self-neglect Mr. X exhibits are unkempt appearance, unsafe, unsanitary living conditions, social isolation, and possible malnutrition. Mr. X may be experiencing cognitive impairment as he's confused, distracted, and there's a discrepancy between what he reports and physical evidence. Lots of empty medication containers may require further substance abuse evaluation. Cognitive impairment is a strong predictor of self-neglect. Due to his history of stroke, Mr. X may have an undiagnosed cognitive disability. Further evaluation is needed to determine if he has a decision-making capacity. Although he states he makes his own meals, his thin appearance and non-working refrigerator suggest he's not providing basic needs for himself. His lack of support system and social isolation warrant further evaluation for depression. This case should definitely be reported to the APS. Thank you for viewing our presentation on elder self-neglect in Houston's 3rd Ward. We hope the information presented will allow for better understanding of self-neglect as a common, underdiagnosed, and dangerous problem that can be stopped by increased identification and reporting to the Adult Protective Services.